Hi, I'm Dr. Arpitha, Consultant Pediatrician and Neonatologist from Nectar Mother and Child Care Hospitals. Today we are going to have a small podcast.
I'm Dr. Umakanth. I'm Senior Consultant Pediatrician. Hello, Dr. Arpitha.
Hi, sir.
We can talk about screen time, which is quite a common topic nowadays, and everybody is worried about screen time. So, what exactly is this screen and screen time?
You won't believe, sir. So the moment the patients discharge their babies from the ICU, they start asking this question: how much of screen time is good? What is screen time? And can I allow my babies to have a video call? Or is it fine to actually feed the babies with the screen on? All these questions are commonly asked. So what exactly is screen time? So screen time is the total time that is spent in front of the screen in 24 hours. So today we'll be talking more about this, sir. So why do we actually emphasize avoiding screen time in first 2 years of life?
Yeah, these first 2 years is quite crucial because a lot of things are happening in a baby's brain. You won't believe, when a baby is born, his brain is only about 330 grams. And by the time he is about 1 year, his brain is weighing about almost 1 kg. So this 90% of the brain growth happens in the first 5 years, more so in the first 2 years. That's the reason we emphasize this 2 years
Cutting
or
down.
1000 years.
Yes, sir.
So when the baby's brain is growing rapidly, there is a lot of cells in the brain. We'll talk a little bit of the science behind this. The cells, we call it as neurons, and there are connections between these neurons. We call them as synapses in scientific terms. In layman's term, we call it as the connections between the nerve cells. You won't believe, there will be 1,000 trillion neural connections or synapses in a baby's brain.
Oh.
That would be 1 followed by 16 zeros.
Okay.
So as the baby grows old, whatever connections are not used, they are lost. But the time the baby becomes a teenager, there will be only 500 trillion synaptic connections, which means half of it is lost. So the baby's brain you can compare to a clean whiteboard. So you can write anything on that, you can imprint anything on that. So it is so receptive, and it is in a learning mode. The first 8 years of life, the baby's brain is in a learning mode. So it keeps learning from whatever is happening in the environment and the surroundings. So basically this happens through the 5 senses. Baby looks at something, the vision, it hears something, the touch, by feeling it hot, cold, etc., the smell of it, the taste of things, he'll put things in the mouth, the taste of it. All these things are giving continuous information to the baby's brain, and they're forming new connections. Apart from that, there are other sensors called as joint sensors. Like if I keep my hand like this, there is information going to my brain about the position of my hand. These sensors, we call it as kinesthetic sensations. These joint sensations are very important to learn the motor skills. That's why if you see a toddler, he doesn't sit at a pace. He's constantly running, he's jumping there, he's climbing there. He's actually learning. So he's learning by trial and error. He's learning how to balance, how to stand, how to walk. So every day is learning a lot of things. Okay. So every time he does one particular act, say pick up a pen from the table. So there is a connection. Eye sees the pen, it sends an impulse to the brain. Then it says the muscles of the hand to pick it up. So one connection is formed. Suppose you do it 10 times, that connection gets imprinted. So that connection will stay. Suppose we don't use that connection, it is lost forever.
Okay.
Suppose this important time which baby is supposed to spend on the surrounding environment is spent on the screen. So screen is basically visual. So baby only sees, and it is some auditory, some music is coming. But the main thing about the screen is one way. It is always one-way traffic.
Yeah.
Baby cannot tell anything. Baby tells anything, screen is not going to interact or respond. Okay. So baby has to hear passively whatever comes on the screen. So if baby is spending say 2 hours or 3 hours on the screen, that much time is replaces the normal activities of which the baby would have done. This we call it as a displacement effect, where the baby's normal activities, the opportunity to learn, the humongous opportunity to learn, that is replaced by the screen. So baby is not going to learn these things, and it cause a lot of problems in the future. Dr. Arpitha, I want to ask you one thing. Why are babies so fascinated about the screen?
From small infants to adults, all of us are attracted to something that's very bright, colorful, something that's very loud, and something that is really attractive to our eyes and ears. So what happens, we tend to sit for a longer period, and the attention span also reduces because of this. Also, if you see, our lives are very slow paced, but when you keep changing channels whatever you want to, or you see a lot of reels of late, so it's just very short span. Your brain keeps moving very fast, so that way our attention is totally towards these screens. I don't know if I have to say this, fortunately or unfortunately, parents are not as free as what they were earlier. So the time that is spent towards the kid is very minimal. So they always prefer the screen time as an option to sit and make the child sit and also feed the baby for a longer period. And especially when the kids are picky eaters, I think this is the best way to stuff in food. So I don't think this is the right method. Anyways, we'll talk about this more. So sir, what functions and milestones are actually lost because of this excessive screen time?
The most important thing is the speech, because babies learn speaking. Again, it's a two-way thing. If mummy asks the baby to say the word amma, and baby says some other word mama, then mummy will correct. So he's learning some new thing. But this two-way traffic is not happening through a screen. So the speech is the first thing to get affected. This is followed by the language functions. Then the screen is, as you told, is quite fast paced. So it makes the baby very impulsive. So he cannot focus on anything which is more than 30 seconds.
Correct.
So the thing is, he cannot, as he grows old, he will not like to spend some time on a book. Book is something which is very dull, boring.
Correct.
The words won't come out and
correct. It's just imagination.
So you have to spend some time, go through the letters, form a sentence, get the meaning behind the book. So that's what his reading is. So the baby which is used to the screen doesn't like reading the book.
And even imagination.
Probably if you give a book, he'll be doing like this.
Correct,
right? Yeah. So the reading is second important skill which the baby is going to lose. And the third thing, because of the short attention span and these things, the babies become more impulsive. So they have problems like attention deficit, being very
aggressive.
Overactive. All these things can happen. I'm sure, Dr. Arpitha, you would remember the days when there was no mobile, no TV.
Yeah, sure.
And it used to sound a little boring, but we would spend our time outside. We would do something. We would make a paper boat and do new things.
Right,
so there was a lot of boredom, but this boredom is very good because boredom will make the child more creative.
Correct.
It makes him explore new things, and his creativity is lost when a lot of time is spent in front of the TV or mobile.
Yes.
And the next important functions which they are going to miss is the social interactions, because they're used to sit in a place and watch something. They lose entire one way of traffic, so they lose their communication skills. They cannot talk with other peers or seniors, and they don't know how to talk, and they lose on a lot of communication skills, and they're quite poor at social interactions.
Yeah, I've seen that also. I think most of our children today are failing to perform well on stage as well, unless and until an extra attention is being provided to them. This is what has been happening in today's generation.
I want to ask you about this thing. So we know screen is not good, but what is excessive, and is there any age limits where it is permissible, or any guidelines are there?
So sir, actually it's divided into three parts. So it's between 0 to 2 years, 2 to 5 and 5 to 10. Coming to 0 to 2 years, actually zero screen time. So don't use screen at all while you're feeding your baby or when you're trying to console your child. Avoid screen running behind the background as well. Encourage a lot of physical activity, and social interaction is a must. Be it a parent or a grandparent, I always insist, whoever is the primary caretaker, please have a good interaction with the child. And if you really want to have a screen time, video calls are definitely allowed to your relatives, but not something that's playing on your YouTube channels. So between 2 to 5 years, maximum of 1 hour, and that too it has to be divided into 2 to 3 sessions, like around 20-30 minutes each. And always remember, it should be supervised and co-viewed. And whatever the content that is being played should be educational and informative. You see a lot of children being very violent. Definitely it is because of the influence of the TV and the mobile phones. So it should be age appropriate, and try to make it more interactive. And a strict no screen time 1 hour prior to the bedtime. We have seen a lot of parents complaining that the children don't sleep before 12 o'clock because the TV channels will be running till 11:30. So that's the major problem. And also see to that your child has a good physical activity of at least 2 to 3 hours, and please cut this, and see to that the child has at least 3 hours of good physical activity and 10 to 14 hours of good sleep. And coming to 5 to 10 years, so try to reduce the screen time less than 2 hours per day. And again, the content should be mostly educational, academic, with a very good social interaction, and always monitor the content that the child is watching. Do not provide any separate device for your child. And I don't know if I have to include this, sir. You know, Aishwarya Rai's daughter, she's 14 and she still doesn't have a mobile phone. And children are not ready for social media platforms like WhatsApp and Facebook, and they shouldn't have a separate social media handle. And see to that the child between 5 to 10 years have a good 10 to 12 hours of sleep and 1 to 2 hours of physical activities. So sir, is there any behavioral effects because of the social media content? Is there any age appropriate things that the child has to be shown?
Yeah, exactly. See, depending on the content, because many times they watch movies with the parents, it could be some hero who is brandishing all the villains, or a villain may be glorified, he may be using foul language or be very aggressive and hitting everybody.
Correct.
For the child, it seems to be normal. So when he watches it again and again, he'll start normalizing this aggression.
Correct.
And he'll also start displaying aggressive behavior or violent behavior, which is not exactly good. Did you know, Arpitha, this bright colored screen and what they zoom out or zoom in they show, and fast moving scenes, they stimulate certain areas of brain which is called as amygdala and the limbic system. When these areas of brain are stimulated, it enhances the impulsivity. Okay. As I told you, when there is boredom, like a plain book, that is going to stimulate an area called as prefrontal cortex, which makes you think. In other words, social media or the screen makes you think less and act more without any thinking. So it makes the child more impulsive. So it is these children want instant gratification and they cannot wait for things, they rush for things, they are very impulsive. Okay. Apart from that, they get addicted to the social media, because suppose a child is having a phone, you take off the phone, he'll start crying.
Correct, yeah.
And sometimes it's very difficult to get the child off the screen.
Yeah, I just got a point, sir, in between. Even this watching Big Boss, the latest trend, even a lot of Big Boss stimulates those aggressions and points, and that's the reason why most of the children are addicted to Big Boss in this generation, which is actually an adult content, I feel, mostly. So, but still it's viewed with the family.
Right point. And once the screen is taken off, or the same thing is coming, the child tends to get depressed because they are not used to boredom and they want something to be happening constantly all the time. They cannot sit for 5 minutes without a screen or without doing anything. So they become depressed, they become anxious, and definitely as a child is spending more and more hours in front of screen for other purposes, his academic activities will come down, but the performance is really going to get affected. In addition to the social interactions which I mentioned earlier. Apart from these behavioral things, are there any physical effects of the screen time on the child?
Again, the major side effects, I would like to put it up in 3 points. One is obesity, sir, and one more is lack of sleep, and one more is the posture. So that obesity is because of lack of physical activity, and this regarding the lack of sleep, it's probably because of this melatonin hormone, which is actually a very important hormone that's released during sleep, and that is reduced because of this blue light. So that actually causes reduction in the sleep time. And one more is the posture. You see a lot of teens with this hunchback and all these things. All this is because of addiction towards your screen, and it causes a lot of pain. At times they also require physiotherapy. It is that severe in few children. It is because probably the parents fail to notice the posture in children. I think the earliest correction is the best way to avoid till it reaches to that extent. Sir, so I said a little point about this screen related to sleep. Can you actually tell more about it?
See, as I told you, screen will affect a hormone called as melatonin. So the screen contains very bright light. Among the bright light, there is a spectrum of light called as blue light, which mimics the daylight. So we have a wonderful mechanism in our body. Brain has a gland called as pineal gland, which secretes a hormone called as melatonin. So during the daytime, this gland is less active. As the sun sets, the gland becomes more active and melatonin is secreted.
Yes.
And melatonin will make you sleep. Our rhythms are already changed because after sunset we use a lot of lights and all.
Correct.
That's already troubling our sleep.
Yes.
In addition to that, suppose you carry a mobile to the bed or keep seeing TV till you go to the bed. Again, the blue light from these screens, it will further suppress the secretion of melatonin, and it will be very difficult for the child to get the sleep, and even if he gets the sleep, it will be a poor sleep and a disturbed sleep. So the one thing can be done. Suppose there is an older child who has got some academic activities and all. It's as you said, it's always better to avoid a screen 1 hour before bedtime. But in addition to that, during evenings and all, they can put something called as a blue light filter. Most of our Android devices or the desktops and laptops, they have something called as blue light filters inbuilt in them. So they prevent the blue light,
Dim the lights.
And the blue light part is taken off, and that is to some extent helpful.
Yes. So can you tell more about this digital hygiene, what it is?
Yeah, exactly. See, like any other hygiene, we need some rules and guidelines for when it becomes inevitable that we have to use screen beyond certain age, like say after a teenager, maybe for a school and those things. But there are certain set rules which would help us to minimize the damage. One is to avoid screen 1 hour before bed. I think you told this, and I also made a valid point that it's to prevent the child from losing sleep. So before 1 hour, no TV, no laptop or no mobile is always a good thing. And in your house, you should have some screen-free zones. In those areas, you should never allow the screen to be there. The three important areas are: one is kitchen or the dining area. There shouldn't be a screen. The family should be sitting. They should be having a family diet. They should interact with each other, and they should not be glaring at the TV. Second one is the bedroom. When they're about to sleep, obviously they should not look at the screen. And third one would be the toilet. We know that most of the people carry their mobiles Add to that maybe car also. Suppose you're going on a long journey, it's better if all the family is talking to each other, listening to a song or something, instead of everybody having their own devices and glancing at it. In addition to this, you can have a digital free period. Okay, it's called as a digital detox or something like that. So set a day, for example, Saturday afternoon or Sunday, we'll not touch any screen, and we'll spend time with each other. We go out, play or read something. That's a good thing to do. And apart from that, the physical effects with the screen cause. So we need to keep few things in mind. One is to prevent that sprain in the neck. We call it as the tech neck, and some those terms are used. So the screen has to be at the level of the eyes rather than keeping a screen down and bending towards the screen. And second thing, to reduce the eye strain, there is a rule called as 20-20-20. Suppose you're working on a computer for some project or something. 20 minutes you're on it. Now take off your eyes from the screen. Look at an object which is 20 feet away and stare at it for about 20 seconds. That would reduce eye strain. And the way you sit and all those things will also help in keeping your posture properly. In addition to that, I think the parents should have something like a parental controls. There are a lot of softwares and things sometimes inbuilt in the computers. So where you can set time controls, not more than 1 hour or not more than 30 minutes. These things are important. You can also reduce the inappropriate content that the child sees.
Yes, we have it all on the TV, sir. Most of them don't know how to use it. I guess we'll have to start implementing those.
And another important thing is, I think we mentioned about co-viewing and supervised viewing. Don't give a device to the child. Don't give a separate laptop. Better to have a desktop which is fixed in a place where parents can always have a look. So this would make sure the child is not viewing inappropriate contents and these things.
Yes, sir.
Arpitha, suppose there is a worried parent, which is quite common we see nowadays. She says my child is already exposed to the screen. I mean, we didn't know much about this. I used to give him mobile for his eating,
No
and
screen.
I was alone at home. I couldn't do anything. I gave him a screen maybe more than 1 hour when he was small. So he's already showing some language delay. He's not talking properly. And some parents, we have seen that their children are talking like cartoons.
Correct.
Because entire day they are seeing some cartoons like Doraemon and all.
Yeah.
They keep talking like this. Suppose parents have these problems, what can they do?
So, if your child is noticing any delay in the speech or is failing to socialize with others, please come and have a chat with us at Nectar Mother and Childcare Hospital. So, the small adjustment is going to make a world of difference for your child and for the parent.
So coming to the end of the topic, let's switch off the screen and switch on the life.
Less screen time, more real time. That's how we're going to make a world a better place. Thank you.
Until the next time, see you. Bye.